As South Africa and other African countries begin to reopen borders and airspaces for international travel, the World Health Organization is urging for strong COVID-19 safety measures. It's in the hopes of preventing a second spike of infections. Dr. Mary Stephen is the technical officer at the World Health Organization Regional Office for Africa. She joins me now. Dr. Stephen, good evening, and thanks for your time. Before we get to your concerns around the second wave, as the World Health Organization, have you been able to understand yet why the rate of infection in Africa has not quite met the modeling or even the expectations that were there at the onset of this disease on the continent?
Yeah, thank you. Good evening. So yes, the evolution of the outbreak in Africa has been different from what was previously predicted, and this was as a result of the early action that the countries in Africa took. Because of this early action in terms of implementation of the public health measures, as well as some of the measures for closing international borders, the lockdown measures implemented very early during the outbreak has contributed to slowing down the progression of the outbreak on the continent. And we are seeing, in addition to the lower number of cases, fewer number of deaths, as well as high number of recoveries on the continent.
What are the risks then that come with the reopening of borders and allowing then travel to go back to what it was?
Yeah, so now the risks of resurgence is high as countries open their economies and open the international travel. But what they need to do is to implement risk mitigation measures, especially for international travels, making sure that they are screening travelers as they arrive within the countries, following up these travelers for 14 days and reporting early cases as soon as any symptom is developed, as well as making sure that all the capacities are in place in all the points of entry, ranging from the seaports, from the airports, from ground crossing, that we are implementing all the different preventive measures is important. And the general public as well, travelers, making sure that they observe the preventive measures is also very important in mitigating the risks of additional cases.
Of course, when we look at other countries on the continent, because the rate of infection there has been so low, there hasn't really been an opportunity to stress test some of their systems or even to fully implement a rollout of a full COVID-19 response plan. Do you think that that's going to be a problem? Should countries start experiencing an increased number of infections?
Okay, so the most important is that countries need to do, if there are places where capacities are still lacking, we have to make sure that these capacities are expanded. Like we said earlier, the capacity to detect early. This is strong surveillance system, the issue of laboratory testing, the issue of contact tracing, and the management of these patients, as well as follow-up of this contact is very, very important. So if these capacities have not been fully tested, we need to make sure that they are there, and you can also test if you don't have the opportunity to use it during an outbreak. You can test it using a simulation exercise. So there is always an opportunity to put to work and test the functionality of whatever capacity a country has put in place. But there is no time for complacency yet. Cases have declined, but we need to still remain vigilant.
Of course, primary health care has come under severe strain during the pandemic as a result sometimes of the restricted access to movement or even access to health care facilities. As the World Health Organization, what are some of the biggest diseases that you feel have been, or treatment of diseases that you feel have been hardest hit by this focus on COVID-19?
Okay, so across Africa, there has been a lot of impact in terms of access to essential health services because of the COVID. And one of the major reasons is because patients are actually afraid of going to the health facilities because of fear of contracting COVID. But in addition to that, services like access to routine care, diabetes, hypertension, malaria, antenatal care have also been impacted, and this also varies from countries to countries. So you see higher number in a country where the prevalence of such a disease is higher, and in countries where the fertility rate is high, you will also see missing of antenatal care and services as well. So it varies from country to country, but a wide range of services are being missed because of the COVID.
Do you foresee a situation where there are countries who are struggling to provide treatment for general health care because there, of course, has been all of this diversion of budgets, and donor funding in particular is also reduced?
Yeah, so we have countries need to ensure access to health care. We have been preaching about universal health coverage, and we definitely need to continue to push and help especially the most vulnerable population to be able to access these services as much as possible at the lowest level of the health system. So looking at different kinds of health insurance to cover the most vulnerable population is also very good to help in increasing accessibility to some of the basic healthcare services that the general population will require.
That was Dr. Mary Stephen from the World Health Organization Regional Office for Africa. Thanks for your time on News at Prime.